Good morning, good afternoon, good evening, wherever you may be. This is Love the Afrobeat Music Talk Radio, your number one African Caribbean online radio. My name is DJ TY, be the place to be. And the program is Today's Africa. Yes, every Saturday at 11 a.m. Eastern Standard Time, we meet here to speak and talk about and discuss and chat about what is relevant, what is trending with us around and across the globe, focusing on Africa, the Caribbean, and the diaspora, as well as other communities beyond. And today we have a special program for you and with you. You see, folks, for so many years, a lot of organizations have been in the forefront where it comes to setting up initiatives to assist internally displaced and externally displaced persons. And sometimes help has come so fast. Other times, it has been non-existent. On this radio program, we have had the pleasure and the wherewithal to have conversations with a lot of groups, be it refugee groups in camps and stuff like that. And one thing that comes to mind was when we had a conversation, as a matter of fact, a couple of conversations with a young man and a group of young men, I would say, in some refugee camps in Uganda. We learned a lot because, you see, at the end of the day, we have to involve everybody, the youth, women, children, the elderly. We have to factor all of them into these equations. And do they get the necessary help? I think somewhere down the line, the lines may be broken, but they may be fixed. Yes, they may be fixed. Because when we talk about internally displaced people, there's a difference between an internally displaced person or an externally displaced person with a refugee or a stateless person. News reports tend to spotlight refugees in sprawling camps, but a large number of people forced to flee their homes never cross an international border. These individuals are known as internally displaced persons, or IDPs for short. Do they get the help? There are so many bureaucratic ways that has been put, or impediments that have been put in this place to help them. Sometimes, like I said, it works. Other times, it doesn't work at all in terms of initiatives that protocols that are used to help them. Let me give you this statistical data. Over 62.5 million people are internally displaced in the world right now. 62.5. And 4.4 million stateless people are recorded around the world. But the true extent of statelessness is estimated to be higher. And when it comes to asylum seekers, folks, 5.4 million asylum seekers are in the world right now. And the question is, what sort of initiatives are being put in place for the powers that be, the United Nations, or even countries or other bodies like the Red Cross and UNHCR and others? Have they put any protocols in there to help people? I bet there's none. Or if there is some, it's not enough. Going back to my conversation with these young people in the camps in Uganda, for instance, the average monthly allowance that the United Nations High Commission for Refugees was giving them was about $10, $10 US for each one of them, $10. And even at that particular point in time, that was around October, November, my understanding was that they were even going to reduce it from the $10 to about 8 or 6 or thereabout. What can 8 or 6 or thereabout do for somebody? Whereas we use multiple amounts of money to buy armaments. Armaments as opposed to taking care of our brothers and sisters who may be in dire need. That's where the program is going to be focused on. Because when you come here, we tell you the truth. We sit under the tree. We discuss issues. We may agree or not agree, but we always want to agree with you because without you, we are not here. We have to listen to everybody's point of view. This is where it gives me the pleasure to introduce, to bring to me and with us our special guest for this afternoon, or this morning, this evening, wherever you may be, in the program Today's Africa, Miss Amal Haroon. Hi, Amal. How are you?
Hi, Thea, how are you? Thank you so
And
much for having me.
it's great to have you on the program because you and your organization are doing some great work that needs to be acknowledged. And for starters, I would like you to introduce yourself to the viewers and the listeners around the globe. The floor is yours, please.
Hello, everyone. My name is Amal. I am the programs manager for the Polycultural Immigrant and Community Services, Etobicoke location in Canada, Ontario. It's a settlement agency that provide help to vulnerable clients, um, bringing them, giving them settlement, resettlement, senior, youth, employment, and mental health, and making sure that they are having, a seamless settlement in the country, and then to become a productive members of the Canadian community.
Wow, wow, wow. Like in my opening statement, I have already indicated that there are a lot of organizations that are up and running on the ground, as opposed to the bureaucratic norms that we have seen over the years with so many organizations. And you work with an organization, Polycultural, Immigrant, okay,
And community
and Community
services.
Services in Toronto, Ontario, Canada. Can you tell us a little bit about the organization, please?
Yes, Polycultural have been for 50 years. Actually, last year we celebrated of our 50 years. It
50
started
years.
50 years of work in the community. It started as a group of volunteers, and it turned into a big non-profit charity registered organization, one of the four leading settlement agencies and resettlement in Ontario. And they provide the organization provide great services for newcomers, refugees, asylum seekers in the country who would like to be they come and they are aspire, so that we help them to achieve their full potential by bringing them, giving them the good welcome, helping them to settle, integrate into the community, and be a contributing members in the community.
Wow, wow.
Yes. In addition to that, we work with more than 40 languages. So we are able to cater, our staff is diverse, and this is one of strengths of Canada, diversity. Diversity is something that shows in every corner of the settlement work. So we see we are also very culturally sensitive. We understand people's challenges when they are displaced, coming from war zones, and then they need to be settled. So we address mental health in the beginning by, addressing the immediate needs of refugees, newcomers, immigrants, and asylum seekers.
Wow. 50 years. That is awesome. That is awesome. Very
Yes.
great, great, very good to know that. How did it come about? I'm very curious. For 50 years, what is the history behind it?
Yes, because in 1973 started with a group of volunteers from a basement, They are Polish, and they started the Immigrant Center for Polish people at that time, and they were serving Polish. And gradually, they thought when the Polish there were more clients or more individuals arriving from different backgrounds. They thought, why don't we extend these services to other populations? And this way, it grows from just a Polish, and then they call it polycultural, to be like a
Oh,
melting pot for all cultures, or for all people coming from all backgrounds from all around the world.
oh, that's interesting. Very
Yes.
interesting indeed. Ah, so yeah, because I was beginning to wonder the polycultural. So that is where it came up from. Great. So it means the people who started it, after all, they started it as a Polish organization, but they looked beyond Poland and said, oh, you know
Yes.
what, there's a melting pot where everybody is going through certain things. So why don't we do it and then go beyond Poland and stuff like that? Would I be
Yes.
right in saying that?
Yes, because it was only for Polish, but also because in Poland, kind of the situation started to settle, so the influx was reduced. So they were serving still, but they said, why don't we expand our
Mhm.
services? Because the neighborhood where they started to grow also with other people coming from other areas. So why don't they started also visiting the center, and this way they thought it should not be only for us, since we have this diverse, and the dynamics of the area started to change and more people are coming. So we have to put this poly and to add to it culture, so we will have more services to cater
Mhm.
for changing needs, and also the number of people arriving in the country.
Wow. Wow. Great. So, my next question will be: what are some of the programs that you provide to the community and beyond?
Yes, we provide settlement and resettlement, senior programs, youth programs, employment, and mental health. For the settlement, we provide even for newcomers who arrive to the country new, by helping them finding a place to stay, completing their documents. If they are immigrant, then they will be helped to find employment. For resettlement, these are programs catering for clients who already they were refugees, but they were resettled in Canada. So when they come, they need also to be assisted to find shelter, employment, to be also help with mental health, and other basic needs that they need for their resettlement. And the program and the services doesn't stop there, because we don't just receive them, put them in a shelter, and then they find housing, they find employment, and then they go. We also help them to be also contributing, and many of our settled clients, they come back as employees, they come back as volunteers, they come back as the support in the community, and some of them, they start their own businesses and become entrepreneurs, which is, it shows the settlement and the importance of the work that the organization is giving to clients in terms of settlement. And last year, from 2022 to 2023, we managed to service more than 37,000 clients,
Wow.
uh, including initiatives for the Syrian initiatives, Afghan initiatives, and now also the Ukrainian cow, the program, the special program. And there is another program also coming, which is reunification of people coming from Sudan and Gaza to resettle also in the country.
Wow. That's really, really interesting. So far as the resettlement or settlement is concerned, what are some of the challenges? Because a lot of people, when they come into the country, language barrier to
Yes.
get them. to settle. And then I think that and the mental health, we'll go into the mental health aspect of it. But then with respect to getting them up and running, language barrier can be a problem, could be
Yes,
challenging.
yes. That's why we provide language instruction, in Canada. So they will be provided with language services. They learn English. We put them for assessment, and at the same time, they will be assisted with, basic settlement needs. So the first thing we address is the language barrier. So we help them to achieve their, English level so that they will be able to be employed. We provide them employment counseling. We provide even daycare for clients who are attending schools or attending, language classes. So they will be also assisted with their children. We have children programs, we have youth programs. Even for youth, we have something, youth job connection, where youth, they come, if they are at school, they will work in the summer. If they are not at school or they stop going to school for some time, we bring them back, we give them the skills and the training to enter the job market and to start, their, uh, this employment as soon as possible.
Okay. So in terms of, like, say, if the person arrives in Canada, do they have to be here before you give them the service, or Polycultural sponsors some of them, like some other organizations do sponsor displaced people or refugee claimants in camps and stuff like that? Do they have to be here before they get the assistance, or
Yes,
how
because
does it work?
there is eligibility, criteria for the services, because they need to
Oh,
be here. We are operating in Ontario, Canada.
mhm.
So the clients, and we have also our services. We are assigned the port of entry at Pearson Airport. So we receive um, clients who are privately sponsored, government sponsored, asylum seekers. In addition to migrant workers, we help them to connect them also and help them to find good resources to, to be able to immediately to be connected. And we provide also for some of international students when they come. Also, we give them the help at the airport. So we are at the port of entry. We have the port of entry because all asylum seekers, refugees, government or privately sponsored, they're coming through the airport through Pearson Airport. They will be assisted. Some of them, they will resettle in different provinces, and the one for Ontario, and some of them will be resettling in the areas in Ontario, in different areas.
So in essence,
Reception
yeah.
centers.
Oh, go ahead, please. Go
Yeah,
ahead.
yeah, there are reception centers as well as settlement agencies. There are many settlement agencies working, and they are doing also a great job by, alleviating the burden and working with community partners to help, all newcomers to settle properly. And these services are funded by the government.
Yeah. And at Pearson, for instance, like you're indicating, do you get information ahead of time as to who will be arriving, and so that you make the necessary arrangements to sort of welcome them?
Yes, yes. We receive who are coming and their flight dates, and then we will be, we have more than 150 employees at the airport. You'll see them with the vest, with Polycultural, assisting clients
Oh,
and
hmm.
making sure that they are well assisted at the airport, directed to the right service, directed also to the right place where they are going to if they're going to move to another province or they're staying in the same province, they will arrange for their flights to those destinations. They make sure every refugee, asylum seeker or privately sponsored clients reach their destinations safely.
Okay. Yeah, we've been talking about privately sponsored and government. Yeah. Could you please elaborate on that private and the government and the others so that the
Yes,
viewers or the listeners will be able to understand that
yes,
and the differences, because I can see the differences there. So if you
yes.
can elaborate on that for me, please.
Yes, there is privately sponsored. That means a group of people will sponsor families from different areas, and they will sponsor them by providing them the settlement. So if they come in privately sponsored, the government will assist in their settlement, but it will be a group of people, and sometimes churches. They gather and they sponsor families who are not able to come because of also financial difficulties, and then they will come here and they will be under the responsibility, or we can say they will be followed up by the privately sponsored, the people who sponsor them. For the government sponsored refugees, they are coming from working with the IOM and the
Before,
UNHCR.
let me indulge you here.
Yeah.
Sorry about that. With the privately sponsored people, so as soon as they arrive, I
Mhm.
would have thought that they'll be handed over to those who sponsored them. But
Yeah.
then you get involved in trying and helping. How does it work? Because already they are sponsored anyway.
Yes, they are
And
already
how does it work?
sponsored.
Yeah.
Yeah, they already sponsored. Even though they are privately sponsored, they come, but they need settlement services. So the private people, they will not be able to provide settlement services, but they will help them find the place. But they will assist them. They will direct them to the agencies, because they will prepare a shelter for them. They will be housed. They will be housed, and then they need to complete their documentation. They need to register for schools. They need to find employment. These are all settlement services provided by agencies, rather by the people who sponsor them.
Mhm. So you'll be working in tandem with, say, I'm still on the private sponsorship thing. So you
Mm,
work together with the sponsors.
yes,
And why is it
because
that why don't you, like, they sponsor them? Why does polyculture get involved? Because once they come in here, then your attention or your energies could be directed to people who weren't sponsored directly. So if they are
it's
here,
for
how does it work?
Okay, because for the privately sponsored, there is a financial part which is by the private sponsors, who are the ones who's taking care of their financials by providing them the assistance, financial assistance. But at the same time, they are they say individuals. They are not organizations.
Okay.
So the organization, we are a non-profit. We are not sponsoring people to bring them here, but we're helping people to settle here when they come. So the government is sponsored. They are also selected families from different refugee camps around the world. They will be selected, vetted, and they will choose to come to Canada. Maybe they will choose to go to another country if they would like to, but they choose to come to Canada. But when they come under the government sponsorship, they will have a financial assistance for 1 year, and there will be a dedicated settlement agency that follow up, make sure that they find right houses. They are school children are registered to school, adults are going to language schools and having employment, making sure they are also following on their mental health. They make providing them counseling, and they make sure of all their aspect. Once they are settled, then they will be on their own, so that they will bring more groups in. for the asylum seekers who come by themselves, they now in Ontario, let's say in the GTA, we have like hotels where asylum seekers are staying. And so our settlement is involved by providing them, if they have helping them to get work permits, helping them in settlement and documents, and all the needs that they will have, and finding and helping them also how to search for houses and how to get, especially because housing is the most challenging part for everybody now. Not only, it's not limited to newcomers or refugees. Everybody is facing this challenge. So the settlement or the settlement and resettlement agencies, their role is to make sure clients, people who come newly to the country, they are settled, navigate the system properly, understand the Canadian system, so that they will be settled seamlessly.
Folks, we are in conversation with Amal Haroon from the Polycultural community, right? Immigrant and Community Services based in Toronto, Ontario, Canada. And she's taking us through getting to know more about the initiatives that has been set by the organization and, maybe some other organizations to assist internally and externally displaced persons. And so far, I'm very, very interested in going further with it, because you know what? 29.4 million refugees are in the world right now. And once we give out the statistics, people do not ask us to how they are helped or how they are being assisted. You see, it's like somebody told me the other time, he says, you know what, prison is for the prisoners. And I told him, I said, no, you are making a mistake. All of us are potential inmates. All of us are potential inmates in prisons. Because the fact of the matter is that we don't know tomorrow. The next minute, the next hour, the next day, the next week, the next month, the next year is not promised to anybody. Anything at all can happen to anybody. To look at 29.4 million refugees in the world, over 62.5 million internally displaced people are also in the world. And we go beyond the call of duty to ask how they are being, assisted. This is where we are having this conversation. It's very important. Tell a friend to tell a friend that you are logged into Love the Afrobeat Music Talk Radio, your number one African Caribbean online radio. In today being Saturday, the first day of June, I can just believe that the month and the year is running so fast. I don't know how fast it's going, but all the same, we are alive. We have to thank God for that. Plus 22 degrees Celsius in Toronto, very sunny here in Toronto. Wherever you may be, good morning, good afternoon, good evening, tell a friend to tell a friend. We are having a conversation about initiatives to assist internally and externally displaced persons around the globe. And with us is the program director for Polycultural Immigrant Community Services. I got it right this time. So
Programs manager.
That's right.
I don't want to end up I am the programs manager.
That's right, programs manager.
Yes.
Yeah, you know what? During the conversation, I'm so much interested in how you receive them. The protocols and all the things that you put in the play in this place to make them feel welcomed. Now let's shift to mental health. See, when the people, whether they are sponsored, privately sponsored, because they know that, like an African language proverb says that if a blind man says, I'm going to stone you, if a blind man tells you that I'm going to stone you, it means he has one thing. His leg or her leg is on a stone, right? So for an internally displaced person, for somebody who has been privately sponsored, when they are coming, they know. We believe that they know that, okay, I'm being privately sponsored. or for the government-sponsored person. See, most of the time we don't think about their mental state. Very important. You're moving from the place of your birth, the place where you work, your friends, you are going to lose your friends, family. You're going to be disintegrated. Some of them are going north, south, east, west, and stuff like that. It's a very heavy burden on you. So when they arrive, Amal, what are some of the things that you put in place for them? Because it's really, it's an important topic for me personally. Because of this, we have a program, the Mental Health Hour, every Tuesday at 6 p.m. Eastern Standard Time with Dr. Tapo, a very well-known mental health advocate from Zimbabwe originally. Does some exceptional work. So on this score, how do you put it together to alleviate that sort of suffering mentally that they bring with them to Canada? Okay. The floor is yours, please.
Yes. The first thing we do, because all our staff is trauma-informed, trained, they understand the difficulties, the clients, the challenges that they face. But the most important thing is when clients arrive here, newcomers, they already resilient because they decided to come. They decided to move. They are in a safe place. So we tap on their, resilience and healthy determinants they came with. That's why this is our role, to avoid them from to be traumatized again by the challenges they will face in a new country, new language, new people. Everything is new, so that could be overwhelming. So here is the role of our staff when they receive our clients. They make sure first they are, well received and they have a place to stay. And also the first thing to address their immediate needs and sit with them and plan a settlement according to their needs, what they would like to do. And this plan is done in a shared way, because we have something called need assessment. The need assessment is done with the family, because they are the one who will decide. Sharing with them, making decisions is their responsibility to decide what to do, but we will show them the way, the resources available, what they can do, and how they can achieve their potential. So it's a 50-50 responsibility in kind of making this. But we don't leave it at this point. After the need assessment, we make sure if the first need to be addressed is the mental health need that they have, we have specialists, we have we call them well-being counselors, not anymore crisis counselors, because crisis is a triggering word, no? So they are well-being counselors. So you want to make sure their emotional well-being, their health well-being, make sure they don't have any health issues. If they need medical attention immediately, that will be addressed. If they need, someone would say to you, I would like a place to stay. So you can start with the housing, depending on the client's needs, and you ask as much questions as you want. But you avoid the questions that trigger traumas. You don't want to traumatize clients again, but you want them to be more resilient, and then they think about the future and they fulfill our potential without difficulty. So the mental health part, and we can say the well-being part of our newcomers, is at the first and foremost assessment in our when we receive them.
Wow. So it transcends to, you take care of the children too. Most of the time that whenever I had conversations with people, most of the times we don't think about the children's well-being or mental health situations.
Yes.
And let's like during the COVID, everything was centered around adults. I quite remember I was on a program And this woman called in and said, you know what, my 5-year-old daughter asked me a question. And I said, what was the question? She says, Mommy, why are you so sad? And she didn't tell her what was happening, but she was dealing with the COVID situation mentally. But the child saw that there was a change in the mother. So she asked. So I said, you know what? Why don't you talk to her and call me back? Tell her, put it on the table, and then tell her, because she has identified your mood. So don't underestimate that child. If that child, 5-year-old child, could see what was actually happening, you should be able to be upfront with her. So this is just to say that, do you also take into consideration, if there are children involved, their well-being assessments too?
Yes, because I said the assessment for the whole family. It's not only for the, for the parents, it's for the whole family. And children also, we have organizations that involved as well, in assessing and find and helping, uh, you know families in case they need mental support. But the thing is, when the client are assisted, their main concern always, they will be their children. So that's the first concern. They will say, I came here for my children. I want a better future for my children. But we also focus on children because we the I said the most important thing in mental health, it is to address the most immediate needs. And the immediate needs could be, I want my children to go to school. That's why when children arrive here, from the next day, they're registered in school and they're off to school. They start immediately. And you know what is amazing about newcomer children? They go to school and they become interpreters for their families after some time because they learn the language very, very quickly. Sometimes we find the children, they talk to us and they say, although we have interpretation services, we have staff who speak more than 40 languages. We have we address all the main languages that by the arrival of the influx of the refugees or the asylum seekers when they come to the country. But children also is a big part because we provide children and youth services, and that reflects all the the family component, from parents to grandparents, seniors. Also, we helping seniors to adjust when they come with families. They are new in the country, but also they need to integrate. They need to be independent. So we provide them with programs that keeps them busy and keep them, active. They can be even volunteering. They have groups of seniors. They are involved in sport, yoga, you name it. So all of these programs involve the whole, components of the family, not only individually. And also in the mental health part, we address this topic in a very sensitive way to avoid the stigma, because people coming from different culture, they look, or maybe they don't speak openly about mental health. So we approach this part and try to we take it as a learning opportunity for the families to understand that mental health is just like any other medical issues you address. You can have a headache, you can have a stomach pain. That could be even something because you're emotionally stressed. It could not be only a medical or physical thing. Just like any physical illness, mental health can be addressed, and also get the right help and the right assistance in this regard.
And with the staff situation, I mean, talking in terms of the mental health, does it have, because I will put it this way, that you may know the narratives or the stories, or if you can put it that way, of behind, why they came in here. Does it have any effect on our staff?
We have also programs for the staff, which we call it self-care. Self-care, they always get trained. They get the right support because, you know, taking care of clients' challenges and needs, that could also, you can see that there's something called vicarious trauma, and there will be also, compassionate fatigue. These are all things are addressed with the staff regularly. So the staff, they receive the support for their own help. That's why we try to manage the workload and the assignment of families and the complex cases that to be addressed in a structured way, so they will not be overwhelmed and they will get the support. So because we also to the staff to be able to take care of clients and of their needs, we need to take care of them as well. So they need to be supported in that front. That's why we have training for self-care. We have training for staff mental health. They go into, there are activities involve the staff so that to alleviate that pressure of helping others, because helping is not easy. It's not easy. You help, and especially when you are passionate about your work, you try always to go the extra mile, and sometimes that might affect you. So you might need to do more self-care and address these issues and have like briefing with you to debrief with your colleagues, with your supervisors, with the manager. So the management is taking that the self-care seriously, and that's why we follow up with the staff and make sure they are in their well-being also is addressed as well as the clients.
So, Polycultural, is it only based in Ontario, or you have?
We are in Ontario, in the GTA. We have 7 locations. And recently, the last location we opened in Orangeville, Dufferin County. So we are also encouraging clients, because, the GTA is saturated almost,
Yes, yes.
so it's always good to encourage, newcomers to move to smaller communities, so those communities will grow as well, will prosper, and then they will become more populated, and also there will be more diversity brought into those communities as well.
Wow, 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 wow. Now the big question, I would say the big question. You've itemized a lot of things that you guys are doing, and I really appreciated what you're doing. It's not an easy thing. You're talking about yourself, mentally speaking, and then you're talking also about making sure that the people that you are servicing are satisfied with the product or whatever you're giving them. For 50 years, I think Polycultural has been doing something great. For 50 years, you don't exist for 50 years without that kind of accolade. I would say I tip my hat to Polycultural for doing what it does best. In terms of having to run it, it doesn't come with pennies. It comes with a lot of money, dollars, moolah. That's what people, the greenbacks. Yes. How is Polycultural funded? Do you get funding from the government, funding from individuals, and funding? Because it's a lot of work that you're doing. Some organizations were born with silver spoons in their mouths. So even if they cough, they get the money. But others, like what you're doing, and some others that I know, scrambling. They are just drowning. So how do you get everything together? Because without money, you can't do it.
Okay. Yes. We are funded by the Immigration, Refugee, and Citizenship Canada. So we are funded also, we have the Immigration, Refugee and Citizenship Canada. We have the funding from Employment and Social Development Canada for our employment programs. We have the Toronto Employment and Social Services, Employment Ontario, Ministry of Labour, Training and Skill Development, Ministry of Attorney General, United Way of Greater Toronto, the Canadian Mental Health Association, as well as the Center of Addiction and Mental Health. In addition to that, we have the funding, we have the donations and the help from the community. There are some community partners, they are willing. Some of them are voluntarily based. They come to volunteer and provide even services. Some are volunteering for the initiatives we do, like when we need to provide, like our latest initiative for the people from Sudan and Gaza who will come under the special measures program from the Canadian government. There is an initiative also by people, because people are donating. So we help them when they come, because they are coming, they are sponsored by their families. They are not coming under a specific program. So when they come, to alleviate that burden of the families, always we do fundraising campaigns, and we get many of our programs. We have also private sector companies that they fund for employing youth. So if there are youth that who need of employment, there are programs, because we recently we're working on our what do you call it, equity, inclusion, diversity, and anti-racism framework, to include more and more segments from the population. Because if you notice, the dynamic also of the communities are changing, and due to these changes, we are also evolving and developing more programs and more services to help them. So those initiatives will help get the help for the people who needs it. That's why, in addition to our generous funders, there are also community partners who are also helping on those initiatives. That what makes Polycultural stand out, because we involve all stakeholders. We are not working alone. There is a social obligation, and this social obligation is not only for Polycultural, for every individual in the country. From a peer support perspective, we all need to help each other, and we need to help newcomers, because also they are the future of the country. They are bringing a wealth of culture, of prosperity that the country will look for, and they are a good driving economic drive force, for the country itself. Yeah.
Yeah, folks, we are discussing initiatives to assist internally and externally displaced persons, and who best to talk to us and to have a discussion. That the program manager for Polycultural, Immigrant and Community Services, Amal Haroon. We are having a very wonderful time here discussing and dissecting and then giving you all the information that we need to help our brothers and sisters who may be desperate times, desperate measures. So this is the point where we will also ask for you as an individual to help, because they can't do it alone. The government can't do it alone. Everybody will have to sort of come together and help, because they are doing some great, amazing work. If they have been able to exist for the past 50 good years, 50 years, it means they are doing something good, something that is applaudable, if I can put it that way. So before we wrap up, not right now though, we'll give you some information as to how you can contribute, how you can help, because you know what, like I said, you, myself, everybody out there are potential convicts or inmates. Anything at all can happen to us. Sometimes we might think We live in Canada, everything is hunky dory. We live in the United States, everything is great. We live in Ghana, everything is great. We live in South Africa, anywhere around the globe, everything is great. But you know what? Things can change within a second. You find yourself or yourselves in situations where you may have said, if I had known, had I known, it's always at last. So let's look at it from so many different angles as to how you can help. Whether you are in Canada, whether you are in the United States, whether you are in Egypt, whether you are in Saudi Arabia, there are so many organizations out there doing what Polycultural is doing right here. You can also help out in every way you can. It doesn't have to be monetary. You can volunteer. You can get so many people around you, solicit for so many things that you think it will help people. I will say that on Love Day, we run a food bank too. In addition to this, as a corporate responsibility, we are self-funded. We are non-profit, not-for-profit organization. I mean, media network. But then we see the need out there for us to be able to tell our stories. The whole thing is that if you have a story and don't tell the story yourself and you get somebody else to tell the story for you, it becomes his story, not your story. So this is where we are to be able to tell our story to the whole world that we need help. There are organizations out there doing so many great things. They need help. They can't do it alone. Remember, situations can change in a second. So don't think where you are, you're fine. Yeah, you may be fine. But at the same time, we have to also look beyond our noses and help out. And this is where Amal and myself, we are chatting about this situation where we find wanting. Amal, you said you made mention of Gazans and Sudanese. Could you, people coming in? Could you please elaborate on that for the listeners and viewers, if somebody will be able to get more attention and then focus on that, because that is what was in the news. And as soon as the television cameras just went over, everybody forgot about it. But the inherent problems are. Is it? Please tell us a little bit about what you're doing to welcome our brothers and sisters from the Sudan and Gaza.
So the initiative is, when they arrive, we want to make sure that they have what they need immediately. So we're addressing basic needs immediately. When they arrive, we would like to help them with basic food, clothing, and as well as giving them startup kits. The startup kits, it could contain anything that they need in the house. So these basic needs are very important for them to start. So they will be able to settle immediately. And to do that, we need to make those kits, and those kits need to be also provided with dignity. They have to be new things. It cannot be all things donated, things that we don't need usually when we think about donation. No, the donation has to be for someone to feel that they are welcome, they are supported, and that they are given this not because they need it, but because this is how we make them stand on their feet and just start their life without any hurdles. So the best thing is to give those startup kits. And now we have this initiative, which is uh, we need to raise funds around $25,000 for each initiative. The Hope initiative for Gazan, who are coming from Gaza, and the Sanad for Sudanese. We will start with this because they are not coming in large numbers. They are some families, numbers of families are coming. So we want to start with them. And this is not the end. This is just the start. So we are starting with them, and we are donating those basic needs that they will have, the food baskets and the startup kit. And please, anyone who would feel that they would be able to donate, please donate. This is a very important initiative, and this is, a way to show our solidarity and help to vulnerable people when they come to a new country, when they need to settle and they need someone to give them all the support that they need so that they can be the next one to help the newcomers as well.
So, in terms of the Gazan um, and then the Sudanese, when are they being expected to, to start? To come in, so that you know what, as a matter of urgency. So
Yes.
we just want the listeners and the viewers to know that, you know what, apart from everything, polyculture
Mhm.
needs you to assist them, voluntarily speaking, financially. Right now, the financial aspect of it is what is more important, because these people are coming, our brothers and sisters are coming in to new countries, and you know what, the government can do their part, the communities can do their part, individuals can also do
Yes.
their part. So, you know what, however and how much you can, sort of help, you should be able to um, call us. Let's call Polyculture. So Amal, you may have to give. Right now, I'm seeing people texting me about how they can sort of get to donate. So how do they do that? Do they call? Is there a number? Because we're supposed to have put down. My producer hasn't been able to do that as of now. We're trying to put the the link to the place
Yes.
that where they can do it. But in the meantime, if you can provide some numbers and stuff like that, that would be appreciated.
The initiative is online, and they can click on the link and they can see how they can donate. If you can share that with the audience, that will be great. And if they would like to donate directly to our to the organization, they can go online and they can see Polycultural Immigrant and Community Services. We have an info at polycultural .org, so where they can also send emails and find out how they can donate and how can they can give to this initiative. And I'm really appreciative, and thank you so much, Theo, for this opportunity, because it is very important to share, as you said, to share. We should not have this story just only with us. We need to tell everybody what we are doing so that they can be on board with us and they can understand the amount of social services and services that provided by individuals, staff, volunteers, and every single member in the community are contributing to this, help.
Yeah.
Thank you so
You
much.
said info polycultural dot
Info at polycultural.org. O-R-G.
org. Yeah.
Yes.
So folks, there you have it. Info at polycultural, polycultural, Poly, cultural, Cultural, polycultural.org. Yes, don't forget, we'll be looking at you. To those of you who have texted me, I don't want to mention names. I don't want to mention your name, but if if you would like to do that, please do that. It's our responsibility.
Yes.
It's not Amal's responsibility. It is our responsibility, because the fact of the matter is that most of the time we think about ourselves. We don't think beyond what needs to be done. Info at
Dot
polycultural.org.
org. I would like to add one thing also, Theo,
Go
if
ahead,
you
please.
allow
Go
me.
ahead, please.
The initiative also is a joint initiative with the Arab Community Center in Toronto. They are also partners, and they are also helping with this initiative to, to make it fly, and people will donate. the thing is, the as much as we get of donation, the better we we will be faster in preparing and the arrival of the coming arrival of Sudanese and Gazan who are going to join their relatives here, because it is a sponsorship by relatives who are extended families in Canada. Yes.
Yeah. And to add to it, folks, I'm sitting here and I'm going to donate if I haven't already donated. So the challenge is on you to also do that. And in any way that we can help Polycultural, we are also going to do that. It's a community responsibility. It's not about your community, it's about all of us. It's not about you, it's not about me, it's about all of us. It's about mental health. It's not about one person, it's about all of us. Because at any point in time in our lives, we may have a mental lapse. So if you see somebody out there, don't think that you are, on you're sitting on a pedestal, so you don't care. We have to care. Care has got to start from us. info@polycultural.org. info@polycultural.org. You go there, call them up, set them up on Google, and then do your part. Because at the end of the day, it's all about us. And I thank Amal for sharing this with us, because you've educated us as to what Polycultural is all about. I'm very intrigued. I'm very, very happy about the genesis of the whole thing, because I was starting to think Polycultural. You see, it didn't start from anywhere. It started from one point and it spread. Polycultural doesn't know race, creed, or color. Yes. It's all about us. It's all about our suffering. One person's suffering should be yours too, because I will continue to say this, that all of us may be inmates. Because if you pass by a prison institution, don't laugh, because you may be at the wrong place at the wrong time. And you may be underscored. So anything at all can happen to us. So we thank Amal, the program director for Polycultural, Immigrant, Community Services in Toronto, for taking her time to come with us. Amal, you can come back anytime. This is your radio station too. It's a community radio station. We take it up and then do what we have to do to help the community, irrespective of creed, race, creed, or color. And at the end of the day, we all belong to one race, and that is the human race. And folks, we'll be back with you next week, Saturday at 11 a.m. Eastern Standard Time. We hope you take care of yourselves and each other. Amal, thank you once again.
Thank you.
Bye-bye.
Thank you so much, Theo. Thank you so much. You have a great day. Thank you, everyone.